For patients presenting with sleep-disordered breathing, with snoring or obstructive sleep apnea, having done the clinical examination, the first thing that I would recommend is to do an ambulatory home sleep study in the comfort of their own house. And this is with using a device for a sleep study. The device consists of 3 or 4 different things that will need to be addressed. There's a pulse oximeter that will look at the oxygen saturation, and this is attached to the finger. There's a nasal cannula that will be attached to both nasal passages. And there's a microphone that will detect the snoring sound signals. This machine is then inserted into a pouch and wrapped around the chest, so it'll look at chest movements and abdominal movements as well. This will allow us to identify whereabouts on the spectrum of sleep-disordered breathing is the patient lying, i.e. are they a primary simple snorer or do they have mild, moderate or severe obstructive sleep apnea? Having done that, it will allow us to choose the treatment plan for the patient. The first thing is to allow them to enhance their lifestyle changes, so losing weight, cutting down on alcohol, not sleeping on your back. Having done these sleep studies and identified where the patient is on the diagnostic spectrum of sleep-disordered breathing, we then want to evaluate the upper airway. And the airway starts from the nasal cavity, and the airflow goes through the nose, behind the soft palate, behind the tongue, behind the epiglottis, and into the larynx and the trachea, the windpipe. So one of the things we do is an awake assessment with a flexible fiber optic endoscope. But the thing that I have pioneered is an assessment called drug-induced sleep endoscopy, whereby the patient comes into the hospital, we give them some sedation, and they're lying down, and we evaluate the upper airway again to see where the obstructive segments, the anatomical segments, is it just coming from the soft palate vibration? Is the tongue dropping back and occluding the larynx? What is causing the upper airway obstruction? So this would be identified whilst the patient is asleep. And this is important because the upper airway is different when a patient is awake and when a patient is asleep. Having done this, certain patients would benefit from appliances. So one of the appliances we use is a 2-piece acrylic device called a mandibular advancement device. And this is tailor-made for the individuals. It's a 2-piece device and it's inserted inside the mouth, and it allows you to protrude your jaw forward like so. By protruding the jaw forward, the tongue comes forward and the airflow is better. The thing that we have to do with this is to use it during night and through the duration of sleep. As a result, some patients find this uncomfortable. So is there an alternative? Well, very recently, there's an alternative called Excite-OSA. This is a device that you do not use during sleep, you use whilst you're awake. And the way it works is it's got these stimulators which sit on your tongue, and it's linked with your Bluetooth on the iPhone, and it'll emit stimulation for 20 minutes before you go to sleep. This will stimulate the tongue muscles and tone them so they do not drop back and occlude the larynx. And it'll help maintain a good airflow, and that would be very useful in patients who do not want to use appliances during sleep. Of course, if you've got severe sleep apnea, then you may need CPAP therapy. And if you do not like any of the appliances and you want surgery, then we can offer multi-level surgery, and we perform minimally invasive radiofrequency surgery in the nasal passage, the palate, the soft palate and the uvula, and the tongue base, in order to improve the airflow from becoming more laminar as opposed to a turbulent airflow.